Hi, I'm Brian Lau. I'm with AcuSport Education, sports medicine acupuncture program. And I always appreciate coming in with the American Acupuncture Council, so thanks for having me. Today we're going to look at a little bit of the anatomy of the bladder sinew channel, and specifically in relationship to bladder 60, kind of like a sphere of influence of bladder 60. So we'll look at using that point, of course, but then applying it, or at least syncing it, linking it with other points in the sinews. So some that would be along what you would think of as the bladder channel, but then we'll draw out the full sinew channel course and kind of look at how it relates to some of the other structures off the primary channel, but more along the sinew channel. So let's start with that. We'll go to the slide and we'll start looking at the first bit of information. So this is a image of bladder 60. So it's just showing, of course, everyone knows the location of bladder 60 between the lateral malleolus and the Achilles tendon halfway. But just a summary of some of its actions. It clears heat and lowers yang. So particularly when there's tension rising up the bladder channel, and you kind of think of stress and being at work and everything, kind of shoulders rising and the whole back line rising. Pacifies wind and leads down excess. That's pretty similar to the first action in some ways in terms of how it plays out in this situation. It activates the entire bladder channel and alleviates pain. A lot of pain indications for this point. Relaxes the sinews and strengthens the lumbar spine. And then it promotes labor. So just a quick note while we're on this image is you can note the course of the sural nerve. So this point would be in a location that would stimulate the sural nerve. The sural nerve is branches off of both the tibial branch of the sciatic nerve and the common fibular branch. They come back together, but then it travels down, pretty much down the midline along the bladder channel, shifts over to the lateral side. So when you would needle bladder 58, you'd be stimulating that, and then down along the course of the bladder channel. So this would be stimulating that. It's nice to know the target tissue and some expectations of where that chi sensation would go, because this is a cutaneous nerve. It would supply sensation down the foot. So you could expect to see some traveling sensation along the bladder channel from that. But if we look at the bladder sinew channel, that kind of helps us draw out some of those actions and indications. So this illustration is showing sort of two levels or two layers of the bladder sinew channel. When we do dissection in the program, we do a 3-day dissection. This would be on day 2 where we start to look at the posterior aspect of the body. And if I were to remove skin and adipose, it's what we would do in a dissection process. The very first structures we get to would be what we see in this box here on the back, which would be the latissimus dorsi, trapezius. Those are going to be the most superficial structures, glute max. And that's sort of our superficial bladder sinew channel. It's a lot of what we see as these branches in Deadman's illustration coming off of the main channel. So it kind of highlights these lateral branches that wrap around to the front of the body. We'll come back and look at the front in just a second. But if I were to remove this layer, reflect back that layer, then I would get to what would be along the main course of the channel, erector spinae, sacrotuberous ligament, hamstrings, etc. A lot of these link at the thoracolumbar fascia. It's multi-layered, so that's kind of our linking point between the superficial and deep layer. This will be the subject of today. If I were to continue from a dissection standpoint, the next layer past the deep bladder channel layer would be the kidney channel, sinew channel layer. So that would be our sort of progression, but we'll stop at the bladder channel today. So back to the branches. This is where I think a lot of the influence of bladder 60 is not so much on the main channel, a little bit for sure, but primarily on these branches. So the latissimus dorsi, trapezius, which branch off of the thoracolumbar fascia, the glute max, which branches off of the thoracolumbar fascia. But if I were to look at the latissimus dorsi, that comes to the front of the arm, to the bicipital groove, and kind of shares fascia with the pectoralis major. So it kind of links into the front of the chest and then follows up the SCM. The platysma would also be part of this and into the facial muscles. I don't have that in the illustration. But you can kind of see this link of the latissimus dorsi, pectoralis major, sternocleidomastoid. So some areas in the front of the body, which a lot of us don't really think about with the bladder channel, but with the bladder sinew channel, there is some linkages into the front of the body. So here's another illustration that shows that from the side, kind of labels it. But we have a lot of, not all of them, but many of the indications of bladder 60. So let's think of those indications from the perspective of these lateral branches. So clears heat, lowers yang, pacifies wind, and leads down excess. That would include things like headaches. Headaches are a big one for bladder 60. Visual, dizziness, bursting eye pain, pain in the upper teeth. A lot of these would correlate with headaches, with bladder 10 area, so into the semispinalis capitis. But if we were to broaden out, especially the SCM, the sternocleidomastoid, would contribute to things like visual dizziness. It can be a component when there's trigger points in that. It can be a component of positional vertigo, of course, headaches. Headaches are a big one. We'll look at the referral pattern for this in a second. But headaches, it can create a lot of referral into the face area and link with facial issues, both pain and other conditions, even things like Bell's palsy to some extent. So it can contribute to, or at least link with facial pain particularly. Pain in the upper teeth, it can refer into that area also. So SCM is sort of one of our big links for that. Upper trapezius too, we'll look at some referral patterns for the upper trapezius. The kind of goal that I want to highlight is that trigger points are becoming increasingly more considered with in medicine in general, but particularly in the acupuncture world. And many of us, I teach trigger point classes, trigger point needling classes within AccuSport education. And I just see it with when I teach, when other people teach, is that there's a tendency to sort of shift away from our TCM when we start looking at more more Western medical language and thought processes and stuff. So I always kind of like to remind back into the channel system and link with distal points and kind of not lose sight of the channel theory when you start doing more orthopedic or Western sort of type approaches. And trigger points is kind of somewhere in between. A lot of the language nowadays is Western, but of course it parallels a lot of what we learn in Chinese medicine. So it's not like a complete divergence or anything. So that's the goal, is I want to consider when I'm needling local points like in the sternocleidomastoid trigger points, I might link it with bladder 60 in particular instances. So another indication, relaxes the sinew, strengthens the lumbar spine, activates the channel, alleviates pain. Stiff neck kind of goes hand in hand with what we were looking at, but trapezius can kind of be a big component of that also, contraction of the shoulder and back. So upper trapezius is going to be one of our big links for that. Fullness of the chest, we can note that the pectoralis major is part of that lateral branch, so that can definitely create a lot of pain and sort of sensations in the chest area. Heart pain that radiates to the back, and then the other one would be sacral pain and coccyx pain, which is a big one. So we'll look at the glute maximus. Last action, I should say, but there's some indications there, of course, too, is that promotes labor. And I'll just kind of highlight and not really focus on it much past this, that if I can create some stimulation in this region of the chest, pectoralis major, that's going to have an influence on the breast and oxytocin, which would contribute to promoting labor. So putting out oxytocin would be, if there's stimulation in that breast area, that's even if it's distally, that's going to have the body put out oxytocin, and that's going to start the labor process when the person's close to it. So just a consideration there. All right, so here's the sternocleidomastoid trigger point referral patterns. I highlighted some key points around the SCM. Though if you're needling trigger points, sometimes with palpation, you might be a little off these points, but these are good starting places to consider with the SCM. And just to note that the SCM has a referral into the frontal area, kind of in the eye and cheek area. I'm not sure if I'd be thinking of bladder 60 for this referral. I might be thinking more stomach channel point, stomach 41. Maybe a different day we'll look at stomach 41 and how it links. Into the ear, I might be thinking Sanjiao 3. So the SCM is a complicated muscle. There's multiple channel relationships to it. But what I do want to highlight is that kind of occipital region. So when there's that occipital pain and palpating the SCM starts to bring that referral, and it's like, oh yeah, that feels like my headache. That would be my consideration, particularly for bladder 60. So when I go to needle, I can just palpate and needle according to what I'm palpating, but I would say Sanjiao 16 is a really common point that I use, particularly from the back end of it. So I would thread not perpendicular, but I would thread that needle through the back fibers of the SCM. A little bit more superficial, I might get the sternal head. If I go a little deeper, I'll get the clavicular head. So depending on how close to the surface, you want to be into the muscle at least, but how close to the surface of the muscle versus deeper in the muscle will get different fibers, so you can change the angle of that. That's a very common approach I do. Gallbladder 12 would be up at the attachment. 20 you can angle it into the SCM or the traps or just straight in. SI 16, I don't needle that region as much, but it's sometimes reactive there. Stomach 9, I would again angle into the muscle. Stomach 9 is a really useful location. Lower fibers, even something like stomach 11, but I don't find those areas become as reactive. I do want to highlight the external jugular vein. So the external jugular vein, which wouldn't be a big deal if you hit it, it just causes a bruise. We don't want to cause bruises. It's better not to hit it, better to know and look for it, but it's not, overly going to be damaging to the person. It's more cosmetic at that point. People don't want a big bruise on their neck, but at the same time, if we can avoid it, better to avoid it. But you can note that it starts and runs behind the SCM. It crosses superficial to the SCM, and then it goes anterior to the SCM. So I particularly like Sanjiao 16 in that area because it's behind the external jugular vein, and I have pretty good access to the muscle without worrying too much about the external jugular vein. Stomach 9 also on the anterior surface, very good. So those are common areas of insertion, but you might modify the location. You don't have to be strict with the location of any of these. When there's SCM strain, it's nice to note how much fascial communication there is with the pectoralis major. Clavicular head in particular for the clavicular head of the SCM, clavicular head of the pec major. Lung 1 would be a consideration, but really just trigger points along the whole pectoralis major can help reduce tension into the SCM, especially if people are desk workers and they're spending a lot of time sort of, closing the chest, driving, desk, pretty much a lot of what we do on a day-to-day basis. People tend to get overactive in that pectoralis major. Even the lats and teres major, those would be considerations to contribute. If I were linking bladder 60 with the SCM, maybe some points in the pectoralis major or lats, these would be starting to build a little bit more of a comprehensive treatment. So trapezius is another big one. Trapezius is multiple channel relationships also. We have gallbladder 21, gallbladder channel, gallbladder 39 is really useful to reduce tension in the upper trapezius. Sanjiao points have an effect on it. There's a lot of channels that converge at the trapezius. But the bladder channel, especially that sinew channel coming up the body, is one of those channels. And again, I can think it kind of correlates to that pulling up tension in the back when we have stress and we're busy, and we want to have that area descend down and drop. We don't want that excess to rise. So those would be a consideration for bladder 60 if that seems to be the correlation. But again, that occipital referral. So this is showing the lower trapezius trigger points and some other like mid-fiber trigger points and the referral into the occipital region. So very common, often missed area with headaches. So, when I am assessing for this, I might kind of spread, even just with a finger, spread through the lower trapezius kind of in the direction that my cursor is going, kind of from a downward lateral direction, cross fiber, and sometimes you'll even see little local twitch responses. This is a pretty superficial insertion. You have to kind of thread right into the muscle. So if you're not used to needling the trapezius in this region, you do have to know that it's a fairly thin region. There's not a whole lot of tissue, especially for people who are thinner. There's not a lot of adipose in this area, and the muscles are fairly thin in this area, so there's not a whole lot of space before you get to the rib cage. So there's a little bit of pneumothorax risk if you don't know how to needle this area properly. But I usually thread through, kind of feeling with my finger. I can feel the fibers, and I want to advance the needle through those fibers, kind of an oblique, almost transverse angle. Too transverse and you're just going through the skin, but it's still relatively oblique transverse. But even Sanjiao 15, gallbladder 21, these are all points you could consider linking. Bladder 10 would be more in, it'd go through the upper traps, but it'd be more in the semispinalis capitis. That would be, of course, a really useful local point for that occipital head pain. But yeah, the lower traps, one that is frequently missed. So this is a composite of some of the pain patterns from the trapezius in general. And I would be thinking more of that kind of coming up the bladder channel occipital referral for bladder 60 more than I would for the kind of classic gallbladder channel distribution. I would kind of think gallbladder 39 for that, among other choices that I might go with that one. That would be my pain referral that I would be looking at. So that occipital pain would be the big one. And again, you could link it with other muscles, pec major, lats, other things like that. And then the final one we'll discuss for today is glute max, because this is a big component of many sacral pain and coccyx pain type patterns. And that would be the influence of bladder 60. So this shows from Travell's book some of the referral, along the sacrum, especially that attachment site, sacral type pain, coccyx pain. So the X's, these, I think the current editions of her book doesn't include these X's because there could be trigger points anywhere in the muscle. I kind of like the X's that showed her clinical experience of where, this region, when there's trigger points, how it would tend to refer there. But I think the modern editions, they take away the X's because these trigger points can refer anywhere in the muscle along these distributions. But I still think there's some value in the X's personally. And they correlate to certain regions of acupuncture points, bladder 35, especially for that coccyx pain, 36, anywhere along that line, actually, there can be trigger points in those lower fibers that can be a big component of coccyx pain. But any of these points could influence coccyx pain or sacral pain. Bladder 54 would be sort of in the main region of one of the motor entry points, as would gallbladder 30. And the black circle here, it kind of represents more just kind of attachment trigger points. I don't off the top of my head know of any point there, but I didn't look that closely with it. But I just think of it as sort of a common area of attachment trigger points. So yeah, just a quick run through of the channel, but particularly the influence, kind of sphere of influence of bladder 60. And I think the idea is linking it with those local points and adjacent points, pec major, SCM, trapezius, lower trapezius fibers if there's occipital pain, glute max with the sacral and coccyx type pain. Those would be really good starting places. So, learning more myofascial trigger point techniques can be great, but then we want to bring it back into our channel system. All right, so I think that is wraps it up for today. So we'll look at some, maybe next time, some more anatomy, kind of go through some of the channel related anatomy. I think it's a really good way to review channels and kind of think about them a little differently if you didn't have this type of approach when you're learning the medicine. So again, I always appreciate and thank American Acupuncture Council for having me, and I will see you next time.